Alright, Barry, welcome back. We're back with another chiropractic crack and coffee where I'm in my home studio in the morning with my cup of coffee. And I'm getting ready to learn more about my profession. In this series, I review YouTube videos of other chiropractors doing chiropractic things. I'm going to watch their technique, I'm going to critique their technique, but most importantly, I'm here to learn new things. So I want to learn what I should be doing in my office when I have trouble symptoms coming in or patients who have a tough condition. And today I would like to learn more about the shoulder. I am here with Synergy Wellness Chiropractic and Physical Therapy, and I'm going to learn about the separated clavicle, elbow, and scapula. I'm thinking that I might learn some new things this time. Last video I didn't learn so much. It was kind of just an average tepid adjustment. Nothing really groundbreaking there. But in this video, I've got a guy here in New York City. He's wearing scrubs. The last guy wore a white jacket. And he's got some posters on there. He looks to be a little bit more evidence-based because he's got anatomical stuff that is condition-specific. For example, he's got a big poster on his wall showing the ins and outs of the disc and how a disc can radiate pain down the leg. He's got another low back pain poster where it's talking about a herniated disc, a spondylolisthesis, a facet. I don't know what that means. I don't know what that says. Syndesmosis. No, that's not right. Facet syndrome, at least. He's got head forward translation poster. Let's see here. Let's zoom in that. How heavy is your head? I think these might be muscle testing images. He's got a hydrocollator sleeve, hydrocollator back there, a microwave. Look at that extension cord going up there. And cervical spine diagnosis poster. It probably shows some degeneration. It shows where the nerve roots come out of the neck. So look at this. He's got all these wires coming out. Maybe that's an x-ray box. But nice table. It's a heel table. This guy looks to be a little bit more evidence-based compared to some of the other ones. So I'm eager to learn some new technique. I'm going to critique the technique, but most importantly, this video is here for educational purposes. So let's get going.
How's that?
We have a montage of different adjustments at first. Little intro video.
Okay, we're gonna muscle test your shoulder. Okay, so what I'm gonna do is, this is the more painful side, correct? So I'm gonna start with the good side. Okay, I'm gonna have you put your arms out like this, and I'm gonna push down. I want you to resist me. Okay, we're checking for an anterior humerus, so and checking your anterior deltoid muscle. 1, 2, 3, resist. Any pain?
No.
That's good. He's doing an examination. Usually these chiropractic videos don't do so much of an examination. So we're gonna learn some new examination techniques.
You're gonna resist me on the count of 3. 1, 2, 3, resist. Any pain? Okay. And relax this arm.
So
here.
apparently testing the anterior deltoid
Palm
tests
out.
for
and lock the elbow. I'm going to pull
shoulder
out this way. I want you to
subluxation.
resist me, and then next time I'm going to pull this way. I want you to resist me. Okay. 1, 2, 3, resist. Good. Any pain? 1, 2, 3, resist. Any pain?
Yeah, it's right here.
Right in there.
Yeah.
Okay.
little elbow pain. He's testing, I think, the
Do you ever get right-sided shoulder pain?
pec major
No,
on
not
the
too much, no.
clavicular
Maybe
side.
every like blue moon, but
Once in a while?
most of the time it's very much the shoulder.
Okay. So now we're going to come over here and test this. So palm up, facing out. Lock the elbow. Good. And 1, 2, 3, resist. Good. And 1, 2, 3, resist. Good. Any pain there?
Yeah, like right
On the last one or the first one?
last one.
Okay. Just relax here. Sore in there?
I'm not sure.
How about here?
Yeah.
So we just checked his pec major, the sternal and the clavicular branch.
There you go.
And one of them, actually on both sides, tested positive, so we're just gonna release that.
Just testing for a weak muscle, and the muscle was weak. He's rubbing the muscle a lot. I'm not sure why.
We go cross fiber like this, across the
cross
pec
fiber
muscle, and then we're
massage.
gonna test it again, palm out. Good, and I'm gonna
Retest.
pull this way, 2 different directions. 1, 2, 3, resist. Good, and relax. So that was the pec major sternal division. And 1, 2, 3, hold. Good, and any pain there?
Yeah, just right here. Just like
In your elbow?
yeah, just where I'm.
Okay, that could be something different. Was that different than previous? Were you having shoulder pain before on the first one?
It's mostly just this area just going down.
Okay.
And I feel like it's just from the resistance.
Okay, 1, 2, 3, resist. Any pain there?
Yeah, same area.
Okay, now we're gonna check your elbow. So what I'm gonna do is I'm gonna open the arm up, resist me. 1, 2, 3, resist. Keep your
Biceps.
palm like that. 1, 2, 3, resist. Good, any pain in your shoulder?
No.
Okay, now we're gonna check the radial bone, and 1, 2, 3, resist.
Triceps.
Any
the
pain?
Radial part.
And 1, 2, 3, resist. Any pain?
No.
Good.
Looks pretty strong there.
I'm gonna open the arm up, don't let me do that. 1, 2, 3, resist. Good, any pain? 1, 2, 3, resist. Any pain?
Nothing.
1, 2, 3, resist. Any pain?
Just maybe a little bit right here.
Right in there.
Well, this
Nothing
guy's
in
got
your
really
elbow.
good
Let's try that
muscle
again.
testing technique.
And 1, 2, 3, resist.
And it's important
Any
to note
pain?
that he's doing a full strength
Same
muscle
spot?
test.
Yeah, maybe a little
In the
bit.
elbow.
It's not
Okay,
like
so
a
we're
applied
gonna adjust his
kinesiology where you're
elbow.
testing to see if
So,
the muscle's
no,
on or
he
off.
just had
It's more of
pain
like a full
When
strength,
we tested the
which
ulnar
is
bone.
important.
So we're just gonna adjust his ulnar. And just relax yourself here. You all right? Wasn't
Good.
painful, right? Okay, you're gonna do this
Well, I
again.
like how he's being
Yep,
careful.
1,
He's
2,
not
3,
going for
resist.
big popping sounds.
Any pain?
He's actually
Just
being
a
a
little-
clinician here,
little
like
bit.
unlike some other
Still in there?
chiropractic videos
Okay.
here. I think I would trust this guy to adjust my extremities so far. He actually seems interested in fixing the person. He's got the activator out. So he's really dialing in on what that elbow is doing. The elbow has, it goes from the humerus to the radial and the ulna. The radial and the ulna articulated with it in a certain way, and if you twist the arm, the radial head will turn with it,
And
and
1,
it can
2, 3,
change
resist.
the alignment
How's
of
that?
that joint structure.
Better?
So
Good.
he seems to be
All right,
checking
check
that
your
from
neck
all
now.
different
Relax
directions.
Actually, one more thing. I want you to take your pinky and your thumb together. Resist me, just on this side. Resist. Good. Now, thumb on top of your finger. Your index finger, sorry.
I'm on top of it.
Yep, just like that. And I'm gonna pull them apart. Resist. Good. This one. What I'm doing is checking a few of the nerves in your neck, okay? Which control these muscles.
Oh,
1,
that's
2,
good
3,
stuff.
resist. Good. And then on the index finger. Yep. 1, 2, 3, resist. Excellent.
So if you have a patient who has an upper extremity complaint, you should always be checking. You should always be clearing out the neck. So you might have a neck nerve compression that is causing even like shoulder pain or elbow pain.
Okay, I want you to stand up again. Check your clavicle.
Checking the alignment of the clavicle. If the clavicle is irritated, like the
So I want you to stand in front of the
sternoclavicular
camera
joint,
here so
it can
people
sit
see
proud.
this. Look at my thumbs.
Yeah, they're
So,
way off.
see how this thumb here is lower by a lot, okay? Definitely more than 5 millimeters. 5 millimeters could indicate a separation if it's over here.
Against the opposite side.
So that's much higher on this side. So if his clavicle's higher on this side, it's going to be lower over here on the other end of the clavicle. So what I want you to do is keep your elbow bent here, and I want you to first raise your good elbow up as high as you can. Okay, and down. And then I want you to raise that up as high as you can. Okay. Your shoulder range of motion is really good. You're lucky. Most people cannot do that when they have their clavicle off by that much. And then if you look here, you can see his scapula is off as well.
Yeah.
His right scapula is lower. So I want you to lay on your stomach.
This guy's good.
I'm gonna take this hand right here and just relax it.
That's a technique
Okay,
that
stand up
adjusts
again.
the clavicle against the rib wall, so it's not really a
And turn around.
traditional bone and joint
Hold it
technique.
around.
It's more of like a muscle on muscle technique.
Okay.
Feels good though.
Okay, look at that now. Much better. Now let's check his clavicle.
Yeah, that's better.
We haven't adjusted that yet.
A little bit better
Look
even.
at that.
Still off.
It's still a little bit higher on this side, but all I did was adjust his scapula in the back, and we adjusted his elbow, but he doesn't have a lot of pain. So if I go in here and I adjust this, it could stir up a little bit of inflammation and pain for a day or two. So we're gonna let it be for now because his range of motion is fine. I want you to go ahead and do that again. Good. The other side? Okay, any pain or stiffness on this side? Not at all. Okay, you're all set.
One last thing.
Wow.
Tell me what you think in comments below. I went to film school.
So he didn't even adjust the spine, which is pretty interesting. So this is a targeted video. This is a focused exam kind of thing where he only worked on the area of complaint. I was hoping to see some spine adjusting too, but that's pretty good. I like this guy. I'm going to watch some more of his stuff. He seems to be really focused on the task at hand. I like his technique of using muscle testing. I need to do more of that in my clinic. I need to study up why he had the hand go into extension and flexion. I've seen that before, but I've never really applied that in my own practice. So good. This is a little bit more of a fulfilling adjustment than I saw yesterday morning. I'm going to listen to this guy's ending thing.
Before I got my doctorate, I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you.
All right, he went to film school. All right, this concludes today's morning chiropractic crack and coffee. All right, I want to do a part 2 of this morning's chiropractic cracking and coffee. I got my coffee cup. I'm here for educational purposes. I'm back with Synergy Wellness Chiropractic and Physical Therapy out of New York City. And I wanted to do 2 of them this morning because the last video I saw this guy, I learned a lot. It was a good technique. It was good muscle testing technique, and he was nice and thorough with his examination. So we're going to watch this one. This is on a long distance runner. We're going to do an ankle and foot adjustment. I'm happy to see that the doctor is doing some spine adjusting in this thumbnail here. So let's see how this one looks.
So this is how you get injured. When you have an unlevel pelvis, you have a subluxated ankle and other issues that are not corrected, biomechanical joint issues, that's how you get injuries.
That's true.
And if you want to avoid those running injuries, it's really good to check with a chiropractor. All right, so we got Phil here. Phil has been seeing me for on and off for I don't know, what, a decade now?
Yeah, 10, 12 years.
10, 12 years, and he took on a new hobby, a fairly new hobby, right? The last few years running.
Yeah, last 5 or 6 years.
So that's something we both have in common. I'm a runner myself. I prefer triathlons, but he's a big runner, and he's had a couple injuries. So he was just in here the beginning of the summer with a groin hamstring injury and sprain strain there, and we told him to lay off of it, and came back for a run. You said you felt a little bit of tightness in there
A little bit.
after what, 6 weeks?
Yeah, the first run was like after 4 weeks. The next run was after 6 weeks.
Okay, because of the coronavirus and because he went away, we were unable to speed this process up. Normally we would use cold laser therapy, and this would get him through that injury in 2 to 3 weeks, half the time at least. So we didn't have that luxury because of coronavirus, so I told him to, when he goes on vacation, not to run, just to lay off of it. It is better, but now he has a new injury. Well, it's actually an old injury that resurfaced itself with a little bit of different pain. That's what it is. So I'm going to show you guys what I'm talking about here. And so why don't you tell them what kind of pain and discomfort you were having?
Yeah, so I started running again about a week and a half ago. And
This
as
only
far
has
as the
55
original
views. This
injury,
guy
it
needs more
actually feels
views.
really good at this point. But my foot has pain. It feels like something's like out of alignment in the foot.
That's probably right.
So he's been running with, we gave him orthotics years ago, but I guess they've been retired since. So he's been running with these orthotics. These are awful. I'm not even gonna say the brand. It doesn't even have a brand name on it. The ones we carry and make here are really great, and they guarantee them. So you can wear them 6 to 8 weeks. We guarantee them. I'm not a big fan of those. I'm not surprised his foot's hurting and his ankle is subluxated. So we're gonna show you how we check that and how we can, it's a really easy check, just a range of motion check, and you'll see. We've done this adjustment on you before, remember? So before you had a little bit of a different kind of pain. You had pain across here, across the top of your foot, right?
And on the outside of the foot, as opposed to the inside this time.
Okay, so he's always had more outside foot pain and across the front here, in the front of the ankle, on the top where the laces would go across there. That's really common for runners, and even if you've just like stepped off of a bus and kind of jumped down or something like that, and you know, or you're a trail runner, oftentimes I see ankle subluxations. Or if you've twisted your ankles a few times, all it takes is two ankle sprains or strains, and there is an inherent weakness in that ankle. That means the joints in the ankle are going to be more hypermobile and more susceptible to a subluxation. A subluxation meaning a misaligned bone, creating a lack of range of motion in that joint. So I'm going to show you here how we can tell right away with him. So when we dorsiflex his feet, you can see this right foot right over here is dorsiflexing more. This one
I can
is
see it
limited
even
by
from
at
here.
least an inch,
The left
maybe an
foot
inch
needs
and
to
a
be
half.
adjusted.
We're going to zoom in and show you that. This leg, this foot dorsiflexes, toes up to his chin or to his head better than this one. This one's limited. Go ahead and watch this.
Look, that's a Kevin Herron poster back there.
You can see my left wrist is forward more than the wrist that I have this black wristband on. So he's limited in this foot. So we're going to go ahead and correct that.
Grabbing onto the talus.
Man, just hold yourself onto that table there.
Yeah,
Now we're
there's
gonna
not always
check
a
it
big
again.
noise coming from that. I know there's another YouTuber,
better, but
chiropractor,
not
who
100%. So we're gonna do one more
I think
here.
he dubs
Just try
cracking
to
noises
relax
into
there.
his video. I'm going to
And I
investigate
want you
that
to hold
one of these days.
Yep.
So did it work? He's going to go a little more down into the midfoot, maybe the navicular, or the
There we
cuneiform.
go.
Got a nice pop out of there.
I don't know if you guys heard that.
I heard it.
And there we go.
That's good.
Now it's even. Now
What's
we
he-
shouldn't have any more problems.
What's he gonna do next?
Okay, so we just adjusted his ankle and his pelvis is off, and I can tell that by just a leg check here, and then also I'm gonna double check it here. And you notice here I'm flexing his legs here.
Yep.
And notice how this leg, this left leg goes, you know, close to the buttock, not always. I'd prefer a little bit more flexibility there, but he's working on that. He's a runner. But this leg doesn't go as far, right here on the right. I have to force it to go even. Now, do you feel that? More stress, more pressure on the right hip?
Absolutely.
Yeah, so the quad here clearly is tight, and it tells me this leg is also short by about a ½ inch, same leg. Tells me that his pelvis on this right side is pulled back and down. We're referring to the top of the pelvis here. So we're gonna correct that because you don't wanna run with an uneven and unlevel pelvis.
Absolutely.
This side up. And then after this, we're gonna scan your feet. And
That's a
now
great
that I
table. It's
adjusted
got
your
flexion.
ankle, okay? And then we'll
ex-
scan your
ex-
feet
What's
and
it called? Flexion
see
distraction.
how flat-footed you
You
are and
strap
see
your
if you need
ankles down,
orthotics.
and you can
All
work
right?
on the low back, where the table will break away, and you can move it to gently kind of stretch out the low back.
Good. And the other side up. We're gonna check his legs again after. So for all those runners and those running enthusiasts, relax here. Good, lay on your stomach.
Pretty good low back technique.
You think that if you go out and run with an unlevel pelvis and a subluxated ankle, you're going to be efficient with your running? No. And look at that. His ankles, his legs, feet are leveled or even. We're going to double check it here.
Yeah, double check
so
it.
you guys can see.
Much
And
better.
Look at that. Am I pushing harder on one side or evenly on both?
No, same on both.
Yep. And now they're even. This leg and this leg goes back evenly. I mean, if that's not telling, what is, okay? So this is how you get injured. When you have an unlevel pelvis, you have a subluxated ankle and other issues that are not corrected, biomechanical joint issues, that's how you get injuries. And if you want to avoid those running injuries, it's really good to check with a chiropractor and somebody that adjusts extremities like the ankles, shoulders, things like that. We're going to scan his feet in a minute here. We're going to finish up the adjustment.
All right.
And I'll show you what that looks like, the foot scan. So what I want you to do here is keep your legs straight, raise one leg as high as you can. Good, and the other one. Okay, how did that feel?
Fine.
That's pretty
Yep,
good.
both legs were going up evenly, so that's what we're looking for. We're checking for a rotated sacrum, and that's that test right there. You're really stiff through here. So I'm just gonna loosen that up and make that.
He's got a jigsaw. He's gonna blast those muscles with his jigsaw. I wonder if that's the Pedibon jigsaw. I wonder what camera he's using to film this. It looks like maybe another wide-angle camera with the full depth of field. So it might be like a GoPro or an iPhone on the wide setting.
Okay, turn over on your back. Slide down a little bit.
It kind of seems like a GoPro because the sound is pretty good.
Hey, not for the tape. Last time we did this, somehow like it
Your
really
shoulder.
hurt my shoulder.
Okay,
yeah,
so have you? Let's have you lay on your stomach.
Okay.
Do that differently.
Okay.
And I can.
Yeah,
take a
in my
look at your
opinion,
shoulder.
anterior dorsals suck.
Okay, go ahead, take a deep breath in. And blow all the way out. Relax your shoulders and back. You
I think
okay
you
there?
should lower the table for that so you can get more leverage on the
So that's a
patient,
hard
get on top
area
of
to
the
get
patient more.
adjusted, right there in the diaphragm area.
I could tell that he was
Sometimes
sort of
people resist that.
apprehensive
It's
about
a
doing
tough
that
area. It
adjustment. He
almost
wanted to
feels like
do
you're getting
the
wind knocked
anterior
out of
dorsal
you,
style
right?
adjustment,
But without
the
the painful
patient preference said no.
trauma of getting the wind knocked
He's a
out
little
of you.
bit, his technique for thoracics is a little bit off.
There.
I'd like to see him
What's going on with your
get on top of that more.
shoulder?
Yeah, I had a pain right where my thumb is.
Okay, right on the top there. Okay.
So a
let's
thoracic
check your
adjustment
shoulder.
seems
Turn
like
over on your
the
back.
easiest thing in the world to do. You just press down on the patient and it pops. But with tough patients,
Right
and if your
Okay.
leverage
You
isn't
ever
just
had
right, then
bursitis?
it can be really
I'm aware
tough
of.
Well,
to
that's
do that
an
adjustment.
indicator right there to have that pain a little bit
Um,
lower down here.
You really have to
Right
scoop
off
up
the edge.
and
Okay,
set
that's an
it.
indicator.
This guy's an older guy,
Precise, but let's
and
just go through
it can
some
be
tests here.
tough
So
to
arms
get
out.
a nice release out of
I'm
that.
gonna
So
push down. I want you to resist me. Ready? 1, 2,
sometimes the
3,
best you can
resist.
do is just do that fast stretch
This one was
reflex
weaker. Any
and
pain?
not go for a big pop.
Little.
A little bit of pain. Okay.
2 on a scale of 1 to 10.
Okay. And we're gonna head and do this.
Okay, he's
palm
doing the
out,
muscle
lock
testing
the
that I
elbow.
saw in
So
his
palm out.
previous video.
Palm out. Yep. Lock the elbow. Good. I'm gonna pull out this way. You resist me. I'm gonna pull this way. Resist me. Ready? 1, 2, 3. Resist. Any pain?
No.
1, 2, 3. Resist. Any pain?
No.
I don't know why he's
Okay.
putting his hand on this guy's hand.
Other one.
It's like he's trying to complete the circuit or something.
1, 2, 3. Resist. Any pain?
No.
1, 2, 3. Resist. Any pain?
No.
Okay. And arms out. And 1, 2, 3. Resist. Yeah, this one's weak again. So. Okay. I'm gonna show you something neat here. We're gonna adjust your shoulder gently.
All right, let's do
You
it.
have an anterior humerus right here, so you're gonna slide up that way, a couple inches. Keep going. Keep going. Another inch or 2. There we go. Good.
He's gonna use a drop to adjust the shoulder. The cervical drop. The headpiece is gonna drop. A little bit of dramatics there. Oh, that's pretty cool. I like that technique. I like my technique better.
Arms out. Tell me if it's painful or you're gonna resist me. Ready? 1, 2, 3. Resist. What's stronger? Any pain?
No, feel good.
That's pretty cool.
There you go. Anterior humerus subluxation is 90% of shoulder dislocations. Posterior is the other 10%, so it's always usually the anterior. Unfortunately, I've had a posterior and anterior throughout my life. I've rehabbed my shoulders many, many years ago. I haven't had issues with mine in 30 years. And all the stress that I put on my shoulders with adjusting people, I knew that in the beginning in my college career that once I had, dislocated my shoulder the 7th time, that I needed to rehab my shoulders if I was going to continue in this career. And luckily, knock on wood, I have not had issues at all in 20 years of practicing. But we're gonna go ahead and check your neck and then scan your feet, okay?
Right.
Let's do it. Check out his neck technique. Motion palpation of the neck. Check for fixations. Nice. He knows right where to go on this patient because this patient's been seeing him for a long time.
Move your toes for me. Good. Relax there for a second. I'm gonna set up the kiosk to scan your feet, okay?
Foot levelers. This is just it's a scanner
You're just filling in a
It's
few
like an
questions
HP
there.
scanner
It'll
for
take you,
documents.
shift.
modified for foot levelers.
And then it'll take you through a few questions. You can pick your 3 most common type of shoes you use. And then it's going to ask you to scan your feet. Make sure you're looking straight ahead, arms at your side when it scans your feet, okay?
I just did an actual
So sneakers,
continuing education
definitely.
course on pedographs
Casual shoes?
where you have
yeah,
somebody
casual
walk through and they step on
Now,
this
going back to when, again, I
ink
wear a different size in my sneaker than I do in
plate.
my
and
dresser.
it measures your pressure points as you dynamically walk through it. And with the pedograph, you can see where the rear foot is inverting or everting, or the forefoot is inverting or everting, or pronating or supinating. You can see if the toes are trying to grab onto the ground as someone walks through it. You can see if they're avoiding putting their big toe onto the graph because they have like a rigid hallux. So this guy's doing a copier scan. It's not very dynamic. It's more of like an imbalance from side to side.
Okay, good scan. We're gonna hit yes.
It's pretty impressive though.
Now it's gonna take a look at your posture. So turn and face me.
So what's going on now?
You look straight ahead, good posture. And you're all set. That's your score. If you turn, you can see there. You're flat-footed. So those orthotics you were wearing were doing nothing to correct the arches in your feet. You have 3 arches in your feet.
No, see, I think they should do exercises and go barefoot more
often. You got a score of 143
to strengthen the intrinsic muscles in the feet,
which is a severe pronation score. You definitely need orthotics.
Well, there you have it. I like this guy's technique. I don't like the foot levelers that he uses. I think the patient should focus more on strengthening the foot, intrinsic foot muscles, and working on the function rather than using the orthotic as a brace or support that's going to make up for lack of muscle tone and muscle weakness. But yeah, this guy, I like this guy. I'm going to watch more of his stuff. He's got really good technique. He's really thorough, and he seems really interested in well-being of his patients. Until next time, chiropractic, cracking, and coffee.